everybody, it's Dr. Mona, and this month is Melanoma Awareness Month. And I want to dedicate today's video entirely to this topic because frankly, it's one that doesn't get talked about enough until it's too late. Melanoma is actually the most dangerous form of skin cancer. There's basal cell, squamous cell, and melanoma. But here's what I want you to take away from this video. When you get melanoma caught early, when we can catch it, it is the most treatable. So the first thing I want to talk about is what is a melanoma. Melanomas come from your melanocytes, and they're the pigment producing cells in your skin and actually in other parts of your body, like it give color to your hair or your eyes. And they're the cells that actually help you get tan when you're in the sun. But when I say help you get tan, why do I say that? I say that because the melanin that's in the melanocytes is actually a barrier that helps to protect your skin from the damage from the sun. And when the sun hits your skin, the melanocytes, which are like little octopus, they release the melanin into the skin and create this barrier to try to help protect your skin. Now, when you develop a melanoma, it develops in those melanocytes. And the reason that it's dangerous is because melanomas tend to start at the top layer of the skin and then they invade downward. And with every stage as it goes downward, we go from stage 1 to stage 2 to stage 3 to stage 4, your survival risk actually drops. If you can catch it at stage 1, you're over 98% survival. But when you go down to stage 4, it's about a 50%. Every year in the United States, there are over 100,000 people who are diagnosed with melanoma, and it's not just in older people. We actually see it in younger people as well, and that equates to about 1 in 30 adults who can be diagnosed with a melanoma in the United States. So who's at risk for developing a melanoma? Well, honestly, all of us are at risk, no matter what your skin color is. So let's go over what some of the higher risk factors are. If you have fair skin, light eyes, or light hair, you have less melanin in your skin, so you have less natural UV protection. If you have a history of sunburns, especially if you have a history of blistering sunburns. Also, if you have frequent tanning bed use, because tanning bed use can increase your melanoma risk by 75%. I'm going to say that again, that's 75%. So for all of those people that think tanning beds are safe, they're really not. Also, if you're somebody who has a lot of moles, 50 or more moles, or if you have an atypical or dysplastic nevus syndrome, that means you have a little bit of a higher risk. And also if you have a weakened immune system. So I want to be very clear, people of color can also absolutely get melanoma. So even somebody who's a type 3, 4, or 5 skin is also at risk. Bob Marley actually died of a melanoma on his foot that went undiagnosed. So it's really important to make sure that you go get checked and have your skin looked at from head to toe. Now let's talk about the ABCDs. Now those are things that we look for as dermatologists when we're looking at a mole. So your A is for asymmetry. So a mole is supposed to be symmetric if you cut it in half. If it's not, well then it's asymmetric. B is for border. You want your moles to be round or oval. You don't want them to have irregular shapes or border because that could signify that that mole is growing in an irregular way. C is for color. You want your moles to have a uniform color. They could be tan, brown, black, but as long as they're uniform, that's something that we want to look at. But also, I want to make sure that it's not a darker mole than what you have. D is for diameter. That means you want your moles to be less than 6 millimeters or the size of a pencil eraser, but I also like to say different. I don't want you to have the ugly duckling mole that doesn't fit the group of your moles. E is for evolving. That means, is my mole changing? So if your mole is changing in color, size, shape, then you might want to make sure that you get it evaluated. And the other thing, if there's one that just doesn't make you feel right, just get it checked because sometimes your intuition knows best. What should you do if you think that you have a melanoma, and what do you want to do with this information? So step 1, I'd say know your skin. Once a month, just do a little check on yourself, use a mirror, or actually ask your partner to look at areas that are hard for you to look at, like the back, your back, or even actually like this area is kind of hard to look at yourself without a mirror, and look and see if anything's new or changed or unusual. Step 2, make sure you see a dermatologist annually. A full body skin exam takes maybe 10 to 15 minutes. And if you have risk factors, you may need to come in a little bit more often, especially if you've had another skin cancer, then we might want to see you twice a year. Step 3, protect yourself. Make sure that you're wearing a broad spectrum sunscreen of SPF 30 or higher. I always want to make sure it's covering UVA rays, so I look for zinc oxide as well. And then make sure that you're aware that sun does come through things like your car windows, and don't think that just because you're driving with a window that that's not protecting you. I also say be sun smart. Make sure that you're careful between the hours between 10 and 4. Maybe wear a hat. Make sure that your hat is more broad brim so it protects your ears. And also sometimes think about wearing UPF clothing, and that's clothing that actually has an ultra protection factor to protect your skin as well. I hope this video gave you something useful, whether that's knowing more about the ABCDEs, remember to book your annual skin exam, or maybe just throw away that tanning bed membership. I mean, if you really want, go to a spray tan. Melanoma Awareness Month exists for one reason: to catch skin cancer before it changes someone's life. Please share this video with your family and friends. It really does matter. And if you have any questions, drop them in the comments below. See you for the next one. Take care of your skin.